What if the very medication that once gave you relief is now quietly shaping your brain in ways you never intended? After 40, life carries a different weight. Responsibilities deepen, stress accumulates, sleep becomes fragile, and anxiety can feel less like a passing storm and more like a constant hum beneath the surface of daily life. In those moments, prescriptions such as Xanax and Ativan can feel like lifelines. They soften the edges of panic, quiet racing thoughts, and offer the promise of rest when the mind refuses to slow down. Yet beneath that relief lies a neurobiological trade-off that few people fully understand when they begin. Benzodiazepines enhance the brain's primary inhibitory neurotransmitter, gamma-aminobutyric acid, or GABA, creating a calming effect by dampening neural excitability. In the short term, this mechanism is effective and often medically appropriate. However, the brain is not passive. It adapts. It recalibrates. Over time, neural circuits adjust to the persistent enhancement of GABA signaling by reducing their own natural inhibitory tone and increasing excitatory pathways to restore balance. This process, known as neuroadaptation, is the foundation of physiological dependence. It does not require misuse. It does not require reckless behavior. It simply requires time. For adults over 40, this adaptation carries additional implications. Metabolism shifts, liver enzyme activity can change, and cognitive resilience is no longer what it was at 25. Memory consolidation, processing speed, and executive function may already be subtly evolving with age, and long-term benzodiazepine exposure can compound those effects. Research has associated prolonged use with impaired attention, slowed reaction time, and increased risk of falls, particularly in midlife and older adults. A fall at 25 may bruise the ego. A fall at 55 can fracture a hip, disrupt independence, and alter the trajectory of health entirely. The risk is not merely theoretical. It is physiological, measurable, and cumulative. Tolerance develops as receptor sensitivity diminishes, meaning that the same dose produces less effect over time. The natural response is often dose escalation, not out of compulsion, but out of a rational desire to reclaim relief. Yet each incremental increase reinforces the neurochemical adaptation already underway. Understanding the distinction between dependence and addiction is critical in this conversation. Dependence refers to the body's adaptation to a substance taken as prescribed, resulting in withdrawal symptoms if it is reduced too quickly. Addiction, by contrast, involves compulsive use despite harm, craving, and loss of control. Many individuals who take benzodiazepines exactly as directed may develop dependence without meeting criteria for addiction. That nuance matters because shame can cloud judgment and delay appropriate care. Thought leaders in addiction medicine, including Dr. Anna Lemke, emphasize that the brain's reward and stress circuits are exquisitely sensitive to repeated exposure to substances that modulate dopamine and inhibitory pathways. While benzodiazepines primarily act on GABA receptors rather than directly on dopamine, their downstream effects on the stress response system can subtly reinforce reliance, especially during periods of emotional strain. The medication becomes intertwined with the belief that calm is unattainable without it. Midlife is often marked by caregiving for aging parents, supporting children, navigating career transitions, and confronting one's own mortality. During these transitions, the appeal of a reliable chemical calm is understandable. Yet the same brain that once responded gratefully to a small dose may now require more to achieve equilibrium. The quiet shift from short-term therapeutic use to long-term physiological dependence rarely announces itself dramatically. It unfolds gradually through tolerance, adaptation, and the subtle erosion of cognitive sharpness. Recognizing this process is not about blame. It is about awareness. Awareness is the first step toward informed, responsible decisions about safety, tapering, and reclaiming autonomy over one's neurochemistry before the adaptation becomes a crisis. There is a moment, often subtle and deeply unsettling, when a person begins to realize that stopping the medication feels more frightening than the anxiety it was originally prescribed to treat. That moment is not a sign of weakness. It is a sign of physiology. When benzodiazepines are reduced too quickly after months or years of consistent exposure, the brain, now recalibrated to expect enhanced GABA signaling, finds itself in a sudden state of relative hyperexcitability. The inhibitory brake has been softened, while excitatory pathways have been strengthened to compensate. Remove the external chemical support abruptly, and the nervous system can surge forward unchecked. This is the essence of withdrawal physiology. Symptoms may include rebound anxiety, insomnia, more severe than the original sleep disturbance, tremors, irritability, perceptual disturbances, and in extreme cases, seizures. For adults over 40, whose nervous systems may be less resilient to abrupt neurochemical shifts, the consequences can be more pronounced and medically complex. The danger lies not only in discomfort, but in misinterpretation. When anxiety intensifies during rapid dose reduction, it can feel like proof that the underlying disorder has worsened, when in fact it may be a transient manifestation of withdrawal. Without careful medical guidance, individuals may conclude that they are incapable of functioning without the medication, reinforcing psychological dependence on top of physiological adaptation. This is where suspense enters the story, because the line between relapse of an anxiety disorder and withdrawal-induced hyperarousal can be difficult to distinguish without clinical expertise. The symptoms overlap, the emotional distress is real, and the urgency to alleviate suffering can drive hasty decisions. Yet within this uncertainty lies an opportunity for clarity. A structured, evidence-based taper is not about enduring suffering. It is about allowing the brain time to recalibrate gradually, restoring its intrinsic inhibitory balance step by step. Safe tapering recognizes that the central nervous system heals in increments, not leaps. Doses are typically reduced slowly, sometimes by small percentages over weeks or months, depending on duration of use, dosage, and individual physiology. The pace is adjusted based on symptoms, not impatience. This approach acknowledges that after 40, neuroplasticity remains powerful, but may require more deliberate support. Sleep hygiene, cognitive behavioral strategies for anxiety, mindfulness practices, and in some cases adjunctive non-benzodiazepine medications can provide scaffolding during the tapering process. The goal is not merely to discontinue a drug, it is to rebuild confidence in one's endogenous capacity for calm. Another layer of complexity involves cognitive risk. Long-term benzodiazepine use has been associated in some studies with impaired memory formation and slowed processing speed. While the relationship between benzodiazepines and long-term dementia risk remains debated, there is consensus that acute cognitive impairment and full risk increase with continued exposure, particularly in midlife and older adults. A medication that once felt like protection from panic can paradoxically increase vulnerability in other domains of health. The suspense intensifies when individuals attempt to stop without supervision, only to encounter escalating symptoms that seem to confirm their worst fears. This cycle can entrench long-term use far beyond the original indication. Yet there is a critical truth beneath the fear. Withdrawal symptoms, while sometimes intense, are typically time-limited when managed appropriately. The brain's capacity to down-regulate excitatory pathways and restore natural inhibitory tone is remarkable when given sufficient time. Medical supervision is essential because abrupt cessation can be dangerous, but gradual tapering is fundamentally a process of physiological recalibration. The narrative shifts from helpless dependence to deliberate healing. Midlife is not a period of decline. It can be a period of refinement. With accurate information, compassionate clinical support, and a structured plan, the transition away from long-term benzodiazepine reliance becomes not an act of deprivation, but an act of reclaiming neurological stability and personal agency. The most powerful shift occurs when a person begins to see tapering, not as the loss of a safety net, but as the restoration of internal strength that was never truly gone. After 40, the narrative we tell ourselves about capacity and resilience matters more than ever. It is easy to believe that because a medication has been present for years, it has become indispensable. Yet the human brain is not static. It is adaptive, regenerative, and capable of profound recalibration when given the right conditions. Safe and responsible tapering is not a reckless experiment conducted in isolation. It is a structured medical strategy grounded in neurobiology, clinical evidence, and patience. It acknowledges that physiological dependence can develop even in individuals who followed every prescription exactly as directed. It also affirms that dependence does not define identity, character, or worth. The philosophical dimension of this journey is as important as the pharmacological one. When benzodiazepines modulate the stress response repeatedly, they can subtly shape beliefs about discomfort. The mind may begin to interpret normal fluctuations in mood, stress, or sleeplessness as intolerable threats requiring immediate chemical correction. Over time, distress tolerance can narrow. Thought leaders in addiction and behavioral neuroscience, including Dr. Anna Lemke, have described how modern life amplifies our drive to escape discomfort at the first sign of unease. Yet growth often resides precisely in the space where discomfort is met with curiosity instead of avoidance. Tapering, when medically supervised, becomes an opportunity to expand that capacity. Each incremental reduction is not merely a lower dose. It is a rehearsal of trust in the brain's inherent ability to regulate itself. For adults in midlife, this process intersects with broader themes of autonomy and health optimization. Cognitive clarity, balance, reaction time, and emotional flexibility are assets that influence quality of life, professional performance, and independence. Reducing long-term benzodiazepine exposure under clinical guidance can support improvements in alertness and memory for many individuals. It can decrease fall risk and enhance engagement with non-pharmacological strategies such as therapy, exercise, breathwork, and structured sleep routines. These interventions are not superficial lifestyle suggestions. They are biologically meaningful inputs that influence neurotransmitter balance, cortisol regulation, and synaptic plasticity. The body and brain respond to what they are repeatedly given. The courage required to begin a taper is often less about enduring withdrawal symptoms and more about confronting uncertainty. What if anxiety resurfaces? What if sleep becomes fragmented? What if the original stressors remain? These questions deserve respect, not dismissal. A comprehensive tapering plan anticipates them. It integrates monitoring, gradual dose adjustments, contingency planning, and ongoing evaluation. It separates physiological withdrawal from the re-emergence of underlying conditions through careful observation over time. It treats the process as dynamic rather than rigid. In doing so, it transforms fear into data and reaction into strategy. Ultimately, safe tapering after 40 is about reclaiming alignment between intention and physiology. Medications like Xanax and Ativan have legitimate clinical roles, particularly in acute settings. But when long-term use extends beyond its original purpose, reassessment becomes an act of responsibility. The goal is not to reject medicine. It is to use it wisely, with full awareness of risks and benefits across the lifespan. Midlife can be a turning point where informed decisions replace automatic continuation. With medical supervision, patience, and evidence-based support, the brain can re-establish its natural inhibitory balance, and individuals can rediscover confidence in their intrinsic resilience. If you are benefiting from our topics, please subscribe, like, and turn on the bell notification so you can see our new videos early.